Hello everyone, today I'll be taking another VivaLive session with QQSphere on the subject of forensic medicine and toxicology under the topic poisoning, and as a subtopic I've chosen organophosphate poisoning. So let's start.
Welcome to the examination. Please describe the characteristic clinical features of organophosphorus poisoning and the immediate steps for stabilization.
The symptoms can have the acronym sludge, which are the muscarinic effects, salivation, lacrimation, urination, defecation or diaphoresis, gastric upset, emesis, meiosis, and bronchoria, bronchospasm, and bradycardia.
That's correct regarding the muscarinic effects. What about the nicotinic effects and the immediate management priorities, specifically regarding airway and stabilization?
The nicotinic effects are at neuromuscular junction, which cause muscle fasciculations or twitching, muscle weakness and paralysis, which can lead to respiratory failure. So we will need to intubate the patient immediately. And then
Yes, that's right. Respiratory support is crucial. Now discuss the pharmacological basis of the specific antidotes used in organophosphorus poisoning. What drugs are administered and how do they work?
The most important is atropine, which is for the muscarinic blockade. Uh, it completely blocks acetylcholine receptors, treating bradycardia, hypotension, and reducing excessive secretions. And pralidoxime as an enzyme reactivator is given, which reactivates the phosphorylated acetylcholine esterase, treating the nicotinic effects.
Excellent explanation of the mechanisms. Now, besides antidotes, discuss the role of general methods of gastric lavage and forced diuresis in acute poisoning cases. Are there any specific considerations or contraindications?
I don't know about that. Can you please explain?
It's all right. Gastric lavage or stomach wash aims to remove unabsorbed poison, most effective within an hour of ingestion, but contraindicated with corrosives. Forced diuresis involves increasing urine output to enhance elimination of certain water-soluble toxins, but may not be broadly applicable and requires careful fluid management. Now tell me about the procedure for collecting and preserving viscera for chemical analysis in autopsy cases. Why is this crucial?
Preserving visceral organs is a forensic procedure to detect poisons, drugs, or pathological changes. The stomach and its contents are tied at both ends, and is preserved to identify toxins which could have been ingested. The small intestine is kept. 500 grams of liver is kept, halves of both kidneys, 10 to 20 milliliter of blood and urine is kept.
That's very comprehensive. Preservation prevents putrefaction and ensures the sample is reliable for analysis. Finally, briefly discuss the medico-legal duties of a doctor in a case of suspected poisoning, where foul play is suspected. What legal obligations must they fulfill?
I don't know. Can you explain, please?
The primary duties are to provide medical treatment, immediately inform the police as required by law, carefully document all findings and statements, diligently collect and preserve evidence, including viscera and post-mortem, and maintain chain of custody for any samples taken. This concludes the examination. Now please focus on the medical disclaimer. You should not rely on this information for medical advice or diagnosis, and you should speak with a healthcare professional or seek care immediately.